With the help of Comfort Keepers, I'm keeping my mom healthy.
I'm keeping Dad on schedule.
I'm keeping my mom happy.
Comfort Keepers in-home professional caregivers can provide meal planning and preparation, health and wellness services, and personal care services through custom care plans that can change as needs change, so your aging loved ones can stay happy and healthy in their own home.
Comfort Keepers, keeping the comfort of home.
Today we have a great guest. Her name is Marguerite Parzen. She is an aging life specialist and the owner of Boutique Care Management. Welcome.
Thank you. Marguerite, thank you for coming in today to speak with us. And Aging Life Care is also known as geriatric care management. So please explain to the audience, what is geriatric care management?
Geriatric care managers are experts and advocates that get hired by families and fiduciaries, attorneys, to help clients navigate the healthcare system. We are compasses in expertise in geriatric care. We get hired to be the quarterback on a healthcare team. We are ones that have expertise in all affairs that have to do with aging well, whether it be aging in place in your home and needing the supportive care of a home care company like Comfort Keepers, or needing the expertise of a new pharmacist, a physician, whatever it may be. Other times, care managers get hired to help folks move into assisted living facilities or senior communities, and we have the expertise in knowing what the options are out there and what the different factors are in needing to make those decisions. Typically, when we start with a new client, we'll go in and do an assessment and put together a document of recommendations of what we think may be helpful to an individual to start that process. So we really are the experts in the field of aging, and we like to say aging well.
And what is your background a little, in terms of that gives you this position?
Right. So care managers can come from all sorts of disciplines. I am part of the National Aging Association, and we have certain credentials that I have met. Care managers could be gerontologists, they could be nurses such as myself, sometimes they're psychologists, and we have a certain expertise in that realm and certain credentialing. My particular business is a nurse care management business, so all of my staff are bachelor's trained nurses, and so we look at care management from the lens of a medical perspective, and tend to get hired onto cases where people may have issues with dementia, they may have issues with a lot of medication management. At times people are going in and out of emergency rooms, or they have this cycle of healthcare problems, and we get hired to help navigate those areas that we call seams of healthcare. When there's transition, say, from a hospital to the home, those are areas where mistakes tend to happen, and so we are the professionals that get to be responsible for making sure that those mistakes don't happen.
So how does your boutique care management company work in conjunction with a home care agency like Comfort Keepers to provide the necessary care to the family? How do you work in conjunction with them?
So we have a really nice and long-standing relationship with Comfort Keepers, and often folks decide that they need a little more help at home, that they're no longer able to get to the grocery store, maybe they need some assistance with bathing, maybe someone's been in the hospital and come home and they've had a surgery and they just need that extra help. So we would typically be hired on the case to figure out, okay, what's going to be needed in order to make this person recover, convalesce, or stay in their home long term. A component of that would clearly be caregiving. And so we would work in conjunction with Comfort Keepers. They would have the caregivers in place. We would work together in terms of giving direction and a care plan to the caregivers. It may be meal-based, it may be queuing for medications, and our team then is the safety net of medical oversight for those caregivers who are well trained, but they're not clinical experts such as ourselves.
Got it.
And let's talk about our, I think Patty and I would agree that's our pet peeve in terms of how you are able to navigate between the medical world, the physicians, and the family and the patient, because that's really where the rubber meets the road, and that's really where I think your advocacy is so important. So tell us how that works and how you get hired.
So we are hired by families or different folks in the elder care community, and that is an area, the communication between the physician's office and the home or the senior community is an area where there is a surprising amount of need for extra support. I used to work in a very large practice in New York City as a nurse practitioner, and I would write prescriptions all day long, and my patients would go home, and then a month later they would come back, and often they had the same issue. And it finally occurred to me that there was something that was happening outside of my office that just wasn't being taken care of. And so for me, there's been a lot of satisfaction in what I do in realizing all the details that need to be managed and taken care of in the home, that in order to execute that physician's directive and that plan of care that physician or nurse practitioner in that office thought was happening. It may be getting the medication from the pharmacy, it may be taking the medication timed correctly, it may be taking care of the daughter who has mental illness. It could be all sorts of different factors that we have in our lives that interfere with that quick plan that unfortunately a physician is making with only the 10 or 15 minutes that they have to spend with us. So for us, there's so much satisfaction in being able to understand what the objective was in that physician or nurse practitioner's office, but also what the ultimate goal needs to be in the home to execute that plan. So it's really satisfying, and the best outcome is for that individual to age the way what they desire that to be, because we all have different wishes surrounding that, and our job is to honor those, whether they're the same or different from mine. They're clearly unique in that own person's life, and it's a really empowering and special opportunity to be able to help somebody work through what it is that they want as they age. So we're lucky to love what we do.
Quality of life.
So can you share with us an example of like a very successful case that you've had with a client, just to give an example to people, like, because you talk about what you do, but there's a lot there. So sometimes when you give examples of what you've done, it clicks better in someone's mind as to, oh, she means that. Okay, I've got it.
Right. So every person's situation is unique,
right,
and why they need us is different, because families are different and health conditions are different. We very much like to work with what we call geriatric teams. So those are groups of individuals that are experts that we come together in taking care of the seniors we take care of. And a typical team may be comprised of us as care managers. There often would be a caregiving company like Comfort Keepers on the team. There likely would be an elder care attorney. There may be a fiduciary and a family member. Often we get hired because folks don't have families, and so all of a sudden there's a senior that is living alone, and they may have one sibling or one child that's living back east, sometimes internationally, sometimes no children at all. And we've had a lot of successes in being able to allow those seniors to execute the wishes that they have for their aging. One example is, I know that we shared a case with Comfort Keepers where there was an elder woman who had long lived in La Jolla and had a very successful life giving back to the community as a physician herself. And she found herself without anyone to take care of her. She had no family left. She had a great team of a fiduciary, elder law attorney. We were lucky to be on the case as Comfort Keepers was, and her wish was to stay at home. So that meant that we needed to take care of all the details that comprised that scenario. And it was 24-hour staff, it was the details of getting her in and out of her own physical physician visits, it was coordination and communication. And we often take for granted in our life the details that are comprised in the phone calls that we all make every day to keep up with our health insurance, to get the groceries in the fridge, to take care of the house that's hot because there's no air conditioning. So that type of care plan and very tight team that's dependent on 24/7 communication, round-the-clock availability, and synchrony as a group is the type of case that we have been successful in, and that's an example of one of those.
So, Marguerite, whether it's aging life care or geriatric care management, I highly encourage people to reach out to you if they have a loved one they're concerned about, whether they are getting the over-medicated, the right medications, and their quality of life issues are being addressed. I hope more people will reach out to you and really understand what you can do for them to really improve their lives. So I thank you for coming today and sharing geriatric care management and what it's really all about, and the improvement in life you make with people. So thank you for coming.
Thank you for having me.
So stay tuned for more Senior Stay or Go TV.